Quality cancer care means to me making sure that all cancer patients have access to quality care, and that includes their treatment and especially the transition after care.
Quality cancer care is defined by having an effective survivorship care plan that's in place, by having that at the time of diagnosis, in transition into survivorship.
Quality cancer care is coordinated and comprehensive and remembers that we're whole people, not just a tumor, and that quality of life as well as quantity of life needs to be considered.
Quality cancer care would encompass the whole person, not just the disease, and would also include the family, because I really see cancer as a family disease. Everybody is affected.
Quality cancer care to me means having access to the resources that you need as a cancer patient that's individual to you. And it's bringing together your cancer team to collaborate and work together for the best care for you as a cancer survivor.
An important part are all the psychosocial aspects that are more complicated in many respects than the actual cancer. We're talking about the financial, the psychology, transportation, all the issues that impact on a person as they live their lives and struggle with this disease.
Little things like getting rid of the taste from the flush that they do of your port may not seem like a big thing to the oncologist, but to the patient it's huge, and those are the types of things to me that make a good quality care.
I also think it's important that patients have access to their medical records, preferably an electronic medical record, so that they can take it to different institutions if they're traveling out of state. I also think it's really important that patients have effective communication with their healthcare team.
To have a clinical team that is compassionate, kind, empathic, and listens, and sets the time aside to discuss the difficult decisions. I negotiated with my primary care doctor to get the 4:30 appointment, his last appointment of the day, so we would have the time to discuss all the questions we had, all the issues. When I had my prostate surgery, the surgeon set aside again an hour to discuss with us all the options, all the choices. So the importance of having the information to make an informed decision was crucial, and not feel rushed, feel we had the time to discuss all these issues.
Cancer survivors need that kind of collaboration because it's a complex disease. There's a lot of physicians and institutions involved generally, and bringing your primary care doctor into the mix with your oncologist and your radiologist and any other doctors that are part of your team, I think is so important. I think having a roadmap through a survivorship care plan is also very important. So it's all those things together that help the cancer patient go through their journey and afterwards dealing with survivorship issues.
I find with a lot of the underserved community, they don't know their rights, and so they're suffering in silence. And that really tears at my heart, because I know that it's hard enough hearing the words, "I'm sorry to tell you you have breast cancer," but now you're not treated like a person. And I always tell them, you have rights. So that's what quality care means to me.